Chapter 14, Lecture 2, The Conduct of the Pharmaceutical Industry. In the previous lecture, you learned about the structure of the pharmaceutical industry in the United States. In this lecture, you will learn about the pricing behavior of the pharmaceutical industry. When you are looking at the pricing practices of the US pharmaceutical companies, besides looking at the pricing according to the demand and according to the supply and cost, you have to also look at the pricing based on the of the innovative drug firms. So because the innovative drug firms, they have the patent to monopolize the market, and they can set their own prices and quantity basically for a period of the patents. The fourth factor you have to consider is the drug companies' marketing response to managed care plans. So we don't have a simple demand and supply. So you have to, there are so many factors affecting the final demand of the patients, and we have to consider all those intermediate factors affecting the final demand, such as the drug companies' marketing when they respond to the managed care plans. So when we look at the pricing behavior, there are potential for non-competitive pricing when the prices are greater than the marginal cost, and this generates an economic basically profits. Which means that makes the market ineffective, right? We said that the efficient allocation of the product is always where the price is equal to the marginal cost. Now, when the price is greater than marginal cost, there is economic profits in the market. Means that beyond and above the payment to all the input factor of production, including the cost of entrepreneurs, for example, if the entrepreneur's hourly fee is $200 and any additional dollar beyond paying for all the input factors of production is considered as economic profits. The second factor that makes the potential for non-competitive pricing is the first mover advantage, that they have this advantage of setting their own price and quantity and market share for the time of the patents. So they have this first mover advantage even after the expiration of the patent. There are some loyal customers, such as physicians and patients. They keep their loyalty for this branded name drugs even with the higher prices. So they always keep this first mover advantage. The promotion ad expenditure, it's actually related to the advertisement effect. So evidence supports both the informational and persuasion effects of pharmaceutical promotion, and also evidence shows the impact of advertising expenditure on increasing the cost of production and the price higher than the marginal cost. So those are the factors, the potential factors for non-competitive pricing. And by advertisement, you can set the price higher than the marginal cost. Looking at the pricing behavior from empirical evidence, we see that the first piece of evidence shows that the prices of brand name and generic products are lower when there are basically higher number of the substitute in the market. So this makes sense. This is actually following the principle of economics. By increasing the number of the substitute, the price decrease. The second piece of evidence says that the prices of branded drugs sometimes increases upon entry of the generic drugs. That makes actually it seems strange, but when you look at it, when the new generic drugs enter to the market, now the branded drug firms, they lose some of the market share to the generic entry. But those buyers they left in the market, they are usually price insensitive. Those are the loyal buyers. They don't want it to change, switch to the new generic entry, generic drugs, even if those drugs are as effective and they are even with the lower prices, they don't want it to switch to the new drugs. So therefore, these branded drug firms, they can even increase their price to compensate for their lost market share because the buyers in the market, they are price insensitive and they don't actually decrease their demand. So the other piece of evidence says that this goodwill established for the first mover basically during the patent period still actually can stay even after the expiration of the patent. They maintain a large market share and higher prices despite the low prices of the generic. So they can still enjoy of this, basically first movers advantage. A high brand name profit margin increases the number of the entrants. Of course, if there is a drug is making good money and there is a good profit, the new firms come to the market. So there are few biochemical industry PhD students. They are starting their own company and they see that there is a profit in the anti-obesity, anti-diabetes product, and they start basically based on what the market signals them that there is a profit. And even if there is a high brand name profit margin at the time of the generic entry increases, the number of the entrant fairly basically increases the number of the entrants very quickly at the time of the expiration of the patent. Again, this profit is a good signal how many firms basically enter to the market up to the point the economic profit is equal to zero. Price accounts for most of the variation in the generic company's market share. So if the generic market comes to the market, their price at the beginning determines their market share. But in the longer term, their therapeutic novelty and effectiveness can actually influence their pricing strategies, and if they are in the overtime, they show their product are more effective, they can actually set the higher price and vice versa. Looking at the pharmaceutical promotional strategies, there are two types of basically effect of the advertisement. The first one is informational and the second one is a persuasive effect. Empirical evidence about the informational advertisement says that this informational advertisement may actually improve the health outcomes of some of the people, some of the patients that they are unaware of these drugs. They have a specific type of disease and they hear in the TV or internet that there is a new drug that they can actually help with their specific disease. So that's actually a good thing, positive thing, because is improving the health outcomes of the people. But this advertising definitely increase the drug costs because the pharmaceutical company include these costs, advertising costs, in their cost of production as well. And this advertising intensity is 20 to 30% of the sale. Means that as they are increasing the advertisement, that increase their sale as well. So, and it is greater for the newer product and it's more important for the bigger, more bigger pharmaceutical product or more expensive one. So there are some actually negative impact of this informational advertisement because It may lead to self-medication, or patient may incorrectly actually understand the uses of this drug, or or the side effect of the drug. And also, this new entrance promotion expenditure help the firms to expand their market share, and also increase the generic competition, which results in less advertising by the innovators. So means that as the innovators they increase their advertisement, that actually increase the competition for the generic firms. So basically, in this case, the last case, as a number of the generic competitors are increased, basically results in less advertising by the innovators based on the empirical study. The second types of promotional strategies is the persuasion effect. The leading team promotion expenditure preserve their market share from new generic entrants. So these generic firms, because of basically this persuasion effect, gain relatively a small market share despite their lower prices. And so basically, the study shows that empirical evidence shows that the greater detailing efforts led to the makes the basically leads to lower price elasticity of demand for anti-hypertensive drugs, for example. So, and you remember that low price elasticity is not good, means that basically the consumers, they are not sensitive to the price. And they think that because of this persuasion effect, they think this specific drug is very magic, and even with the higher prices, they prefer that one. Depends on the type of the advertisement, how to persuade them that to be insensitive to the price. So when we are looking at the product innovation, we have to also consider the new drug development, which is a sequential process. So first there is a review development, a status of the drug, to decide to continue or abandon the project, right? That's the most important and the first step, basically. And then the expected revenue depends on the therapeutic properties of the drug, the size of the target market, and the number of the substitute drugs. So when you are thinking about launching a new drug, you have to, the first step, you have to find out what is the size of the basically target market. If you wanted to find out about the size of the target market, then you have to find out exactly the therapeutic properties of the drug. So if you make a mistake, then your calculation, estimation of the target market will be actually wrong. And then also for the size of the market, target market, you have to also find a number of the substitute and determine basically what would be the potential market share for your product. The anticipated cost depends on the frequency and severity of the adverse reactions to the drug and the projected additional development, marketing, distribution, and production costs. So the other factor in product innovation is the determinant of the research and development spending. So you have to consider the amount of the expected economic profits. You have to consider the difference between the expected future streams of the revenue and cost, the contemporary profits rate, and the past R&D success, and the market value of the firm as a measure of the expected revenue. So these are the factors and parameters you have to determine, and any mistakes of any of these may actually lead to the huge actually fail of the launching the product. So as you can see, the R&D intensity of the major pharmaceutical companies, there are a lot of increase and decrease over the past few years. So because of all these factors we mentioned. The product innovation depends on the firm's size and innovation. The larger firm tend to face a greater incentive to undertake successful R&D activities than the smaller one because of all the economies of scale we already talked, resource capability, risk absorption, and the research economies. So the larger firm also face greater, on the other hand, bureaucratic, basically, problems since because of the red tape, it slows creativity. Red tapes refers to the concept of the red tape is ease of doing business. So what does it mean? It basically refers to the bureaucracy and regulation, which is more larger in the larger firms. So that's why the smaller firm maybe actually have advantage sometimes as well. So looking at the different empirical studies between the larger and smaller firms, we can see, yeah, larger firms have an innovative advantage because of the capital and advertising intensive and relatively concentrated industries. But the smaller firms may be more innovative in terms of the capital requirements for manufacturing also is relatively low in pharmaceutical industry. So that's specifically in pharmaceutical industry, they don't need a high capital. And they may actually enjoy from the smaller bureaucratic actually problems. The skilled labor of the pharmacologists, biochemists, and immunologists, among others, they can actually come together, a small number of them, and create a startup, a small firms, and basically avoid the big firms with the more bureaucracy and regulation cost. The pharmaceutical innovation, basically they have a mixture of firm sizes fostering innovation, and the innovation of the smaller firms is greatest when the large firm dominate in an industry. In summary, the conduct of the pharmaceutical industry, what general conclusion have studies reached concerning the drug price competition. The evidence shows that although there is a competition in pharmaceutical industry, the degree of competition is not perfect. So the research indicates that the price competition exists in pharmaceutical market with the firm competing on a pre-patent and post-patent basis. And the empirical evidence also indicates that the prices of the brand name and generic products are lower in markets where a greater number of substitute products are available. This is the end of lecture 2.